Welcome back to the Armor Men's Health Hour with Dr. Mystery and Donna Lee.
Hello and welcome to the Armor Men's Health Hour. I'm Dr. Mystery, your host, here as always with my incredibly computer savvy and competent co-host, Donna Lee.
For those of you who don't know, when I make a boo-boo, before we start talking, that's why he makes that reference.
If you have an opening for an information technology expert, send us your job listing. We'll send you Donna's resume.
It should not be me. I can barely touch the record button, but I do produce it sometimes.
Right. I'm a board-certified urologist. This is a men's health show, and this show is brought to you by the urology practice that I started in 2007, NAU Urology Specialist.
That's right, and your name is Dr. Mystery, M-I-S-T-R-Y, not like mystery novel.
It has been called gimmicky.
Yes, somebody thought it was fake.
Oh. If you thought I was going to come up with a name, you think that was the one I was going to come up with?
Misspell the word mystery.
That's right. Let me tell you what name I would have come up with.
Uh-oh.
Dr. Pekar.
Oh, no. Oh, no.
Speaking of, we have a special guest today.
But before we get to that special guest, Donna, why don't you tell people about our practice and how to get a hold of us?
That's right. Our practice is lovely, and it's all over Austin and Round Rock, North Austin, South Austin, Dripping Springs. We have 4 MD surgeons. We have 5 mid-levels, sex therapy, sleep coordinator. What am I forgetting?
2
Two pelvic floor.
You better not forget them.
I know, they're
stab
lovely.
you in the heart.
2 pelvic floor physical therapists. You can reach us at 512-238-0762 during the week. You can ask for me. I talk to a lot of our radio listeners now.
Absolutely, and we want to see you. So
That's
if
right.
you have a
come on
problem,
in.
don't delay your care. Come on in. We'd love to take care of you.
That's right. COVID or no COVID, we're here for you. And then our website's armormenshealth.com. Send us your questions to armormenshealth@gmail.com.
And today we have a guest that we've had on the show before, and I really thank you for coming back to us.
Thank you
it's
for
Dr.
inviting me.
Nathan Pekar.
That's right. Not Pekar.
P-E-K-A-R.
P-E-K-A-R.
That's right.
And he's a physician at Victory Medical. How long have you been with the group?
Got to Austin in 2009 with Victory. Was a physician for 10 years with the Air Force before that. Hope to be in Austin for at least another 20, 30 years practicing.
Forever.
Well, good for you.
Well, someday I might die.
No. No.
So when I started my medical practice, I did general urology, and I started doing a lot of hormonal therapy. And then I started noticing that the way that men were getting testosterone out there was really not fully thought out. And one of the big reasons I thought that is because the cardiac implications of having low testosterone and just being overweight and lethargic and things like that in general were not a lot of people were doing it. Then I had a very good friend in his early 50s, and he had a heart attack when he was supposedly under good care by a competent cardiologist. And then a very well-known infectious disease doctor up north, he dropped dead at 48 from a heart attack. And you start wondering to yourself, and what are you supposed to do? I already went to the doctor. I got my cholesterol done. Is there anything more else I can do to make sure that I don't get hit by a cardiac event?
Well,
and so I thought that you could give us some insight into that.
I'm so glad you brought that up.
What a good segue.
A great segue. So Victory's had this program for about 4 years now called the Heartwise Physical. It's basically an executive-style physical that any patient can do. You don't have to be an executive.
Covered by insurance?
It's covered by most insurances, most commercial insurances. So what we're able to do with the Heartwise that you're going to get beyond a normal physical is a much more advanced cardiac workup. Obviously, everything starts with the heart. On the Heartwise, where you start with the heart echo, we look at the heart before and after doing a treadmill test, and we're able to pick up valve issues, major heart-related issues that wouldn't be picked up on a normal physical.
And you're looking to see if the heartbeat, the look of it, changes with exercise, which could be a sign that some parts aren't getting blood when you're exercising, which you would start seeing even before chest pain.
That's correct. Yeah. So a lot of the early signs of heart disease aren't going to show up on a blood pressure or even
an
have
EKG
symptoms or an EKG.
Yeah.
So let's say the heart echo itself looks fine. Then we also look at the arteries themselves too on the physical, and that's much more advanced than what you're going to get on a normal physical. Between the big arteries and also the small arteries of the body. So the heart pumps the blood, it goes to the big arteries first, and then that blood will then go to the small arteries. What a lot of people don't realize is that a lot of times it's the small arteries that will show the disease well before the large arteries do. And the small arteries will often show disease before the blood pressure gets elevated.
You know who knows that the small arteries cause problems before the big ones? All those guys out there with erectile dysfunction.
That is
because
exactly
the
right.
smallest artery that has importance for us is the ones that go to our penis. Then the next size is the one that goes to our heart. So when your penis goes out, you got to be a little worried that your heart may go out.
That is exactly right. So we have something called the cardiovascular profiler, and it's actually used on the wrist, but basically computers are able to analyze the waveforms of the without getting a bunch of computer jargon, but the waveforms of the arteries to interpret how well the arteries are able to expand or how elastic they are. That's really the best way we have for detecting small artery disease first. There is a pretty high correlation with small artery disease and erectile dysfunction, like you mentioned. So I see that a lot in my young males, let's say 30 to 40 range, where they're having ED issues, and we'll see that on the Heartwise physical.
What an important thing, right? So, I mean, it's one thing to fail on a date, but it's something else entirely to drop dead from a heart attack, 10 years later, when the erectile dysfunction could have been very important telltale sign of something to come. So for us, when we find somebody like this and we put them through a cardiac evaluation, oftentimes, even with a cardiologist, we'll be disappointed that they didn't do more than just kind of like talk to them, because I sent them there to get like an advanced, invasive executive style physical is really what I want. And you have to go to a special program and know what you're missing out, or you won't know what's even available to you.
That's exactly right. So let's say they do have early small vessel disease. That's definitely going to get missed even on a carotid ultrasound. You might see plaque on a carotid ultrasound, but you're not going to see that loss of elasticity of the arteries like you will with the profiler. So a profiler is probably the best way to pick up early erectile issues or potential erectile issues in a young male.
That they are vascular in origin, and that could be the sign of something going on. And why I tell people it's important is that, let's say you have a borderline cholesterol and somebody has decided not to put you on drugs, but now it ends up that either your CT scan of your heart is abnormal or this type of profiler is abnormal. We might have lower thresholds for what our target cholesterol is for you. Is that right?
That's exactly right. And also blood pressure. Let's say their blood pressure is 130s over 80s consistently. Maybe I would have just done lifestyle changes, but now I'm seeing that profiler showing obvious small vessel damage or loss of that elasticity of the arteries. I'm probably going to more aggressively treat that. Maybe still try lifestyle, but my threshold for going to perhaps even medicine is going to be a little faster in that male.
It's so important, and I'm going to just reiterate this. There's normal, and then there's normal for you as an individual patient. Just like when it comes to testosterone levels or thyroid levels or exercise levels or whatever levels, you can publish normal blood pressure levels. There are levels that as a physician you tolerate for people who are diabetic and people who are non-diabetic, because the diabetic is more at risk for heart disease. So by doing a more advanced invasive cardiac evaluation, you're able to establish a new normal for that person and make sure that you're not kind of skirting the importance of cholesterol and blood pressure.
That's correct.
It's almost like you know what you're talking about.
I'm telling you, it makes me angry. How does that sound? Because I think that these kinds of things are exactly what you should do. And so when people call me up all the time, they say, I'm 40, what should I get done? I tell them this. I tell them you should figure out if your heart's going to poop out at 48.
Well, now they can go to Dr. Pekar for a Heartwise physical.
That's right. And so as part of the Heartwise physical, you mentioned the screener. You mentioned an exercise echocardiogram.
Correct.
What else do you include, even including lab work?
For the big arteries, we do the carotid arteries to look for plaque there. Obviously it's one of the easier arteries to see in the neck, and then also the aorta in the abdomen.
So you do an abdominal ultrasound, a carotid ultrasound. And when you do labs, do you do advanced lipids? Do you look for the different size little cholesterol levels?
Unfortunately, a lot of the commercial insurances aren't covering that yet, although we can definitely do it as an add-on. It's not standard yet, although in the near future we're hoping that's a standard lab that insurances will cover. There's a lot of labs, unfortunately, that insurance coverage can be an issue, but we definitely do a very thorough liver, kidney, electrolytes. We look at all the hormones, all the vitamins, of course, prostate screening and things like that. Anything that we can get through insurance, we can make it as advanced as possible.
And the patients can pay for a specific test. If you recommend the test and it's not covered by insurance, they can pay a nominal fee to have that test done.
Absolutely. We don't like to surprise patients with any fees, obviously, but at the visit, we can discuss other advanced options as well.
But I would encourage those patients. There are some things that are worth a few bucks.
Right.
It's never as expensive as you think it's going to be.
Right.
Might
be $20, $30 for all you know.
It may be a couple. You can probably get all these tests out of pocket for less than $1,000 and give yourself a great peace of mind that things are going to be fine for you. So
absolutely right.
If they want a Heartwise test, how do they get a hold of you?
They would just call our main line. It's 512-462-DOCS, D-O-C-S, or 3627.
Right.
So, or they can go online. We're available through ZocDoc, victorymedical.com as well.
Well, thank you so much, Nathan.
Thank you.
That was
Dr. Pekar.
Thank you for having me back.
Still,
Pekar.
my namesake.
You two should go into business together.
We should.
Dr. Mystery,
Mystery
and
Pekar.
Dr. Pekar. You
How
can
do
reach
people get
us,
hold of us?
512-238-0762. Our website's armormenshealth.com. Thank you so much. Listen to our podcast. Thanks, Dr. Pekar.
Thank you very much.
The Armor Men's Health Hour is brought to you by Urology Specialists. For questions or to schedule an appointment, please call 512-238-0762 or online at armormenshealth.com.